So the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing. So go ahead, take a look at this ECG strip and drop your answer into the comments below. Let us know what you think. I'm going to jump right to our answer today. Our correct option is option number 1, ventricular tachycardia, or VTAC, as you may have heard this. So VTAC happens when we have 3 or more PVCs, or premature ventricular contractions, in a row. It tells us all of this in our name, ventricular tachycardia. We're having a speed problem with our ventricle. So essentially the ventricle is taking over as the pacemaker for the heart. Again, let's go back to the name tachycardia. We also know that we're going to expect a tachycardic heart rate, so a beats per minute over 100, because 60 to 100 is our normal range of heart rate. But what we're going to see here essentially is a bunch of QRS waves that are irregular. So like the PVCs, our P wave is going to be invisible and buried within that QRS complex, and the QRS interval is going to be wide and distorted, which would mean it be greater than those 3 small squares, which is what indicates that it is a ventricular problem. So we need to treat this right away, since VTAC is a precursor to the life-threatening VFib, or ventricular fibrillation. And remember, we always defib VFib. So again, our correct option is going to be option number 1, ventricular tachycardia.
The nurse has taught a client about the prevention about deep venous thrombosis, or DVT. Which of the following statements by the client would require follow-up? So we are looking for a statement that indicates the client doesn't understand DVT prophylaxis or prevention. So option 1, the client states, I am not at risk for developing a new DVT because I've had a DVT in the past. This is going to be our correct option, our correct answer choice, even though it's the incorrect statement, because we would need to follow up on this. Having a DVT in the past does increase your risk for developing them in the future. So we need to make sure that these clients are protected, taking the right precautions so they don't get another DVT. Option 2. The client states, I will plan rest stops during long car rides to get out of the car and walk around. That's a great practice and something we all should be doing, frankly. Anytime we are sitting for long periods of time, so car rides, plane rides, post-operatively, we definitely want to make sure we're being as mobile as possible, getting our legs moving, that blood pumping, so we don't get a DVT. So this is our incorrect option. Option 3, I should wear compression stockings on days when I'm working long hours. That's a great thing. They should be doing that. Same concept as option 2. We want to just kind of keep that blood flow going and prevent it from kind of hanging out down in the legs where it can form clots. And option 4, I will notify my healthcare provider if one of my legs looks larger than the other. Again, an incorrect option, but a correct statement. They should notify their healthcare provider. If a leg looks bigger than the other, if a leg is red, tender, more so than the other, that's kind of a sign we have DVT going on, and we do need to notify the doctor so we can get started on treatment. So kind of circling back, because I know this is kind of confusing with the incorrect. Option 1 is our correct answer, because if you've had a DVT in the past, you're at risk for getting one in the future. Thanks. The nurse is teaching a client with newly diagnosed hypertension. Which of the following information should the nurse include? Select all that apply. So for a select all that apply question, at least one of our answers, more than one, is going to be correct here. So let's kind of see what's going on. On option 1, consider participating in a smoking cessation program. That is going to be a correct answer here. We know that smoking increases the risk for hypertension and can make hypertension worse. So anything we can do to eliminate that risk is going to be a good thing for our client. Option 2, practice stress management techniques. Again, we know that stress is associated with high blood pressure, so if we can reduce our stress levels, that's going to help out our hypertension as well. With option 3, engage in moderate exercise every day. Like the first 2, we know that exercise improves our blood pressure, improves overall, heart health, gut health. It's good for us. We should be doing that regardless of our hypertension, but especially with clients with hypertension, we want them to exercise every day. And then option 4, consume a low fiber diet. This is incorrect. We definitely don't want to recommend that to our clients with hypertension. For our clients with hypertension, we want them on a heart-healthy diet. So that's going to include some sodium restriction, eating lean meat, avoiding, red meat, steaks, those kind of things. Low fiber is not going to be what we'd go for here. We want to go for heart healthy. And then with option 5, check your blood pressure before taking metoprolol. That's something we're going to recommend to our client. That's a correct answer. We want to make sure our blood pressure is okay, especially if we have a newly diagnosed hypertensive client. We need to be checking our blood pressure with new medications, just to make sure we're not over-medicating, under-medicating, those kind of things. So we always want them to have a blood pressure cuff at home and teach them how to do those things themselves. So our correct options here are options 1, 2, 3, and 5. The nurse is caring for assigned clients. The nurse should first assess the client who has. So in this option, we're looking for the priority, which usually means it's the client at highest risk or the sickest client. So let's look at our options. Option 1, a client with chronic obstructive pulmonary disease or COPD, a pulse oximetry reading of 91% on room air, and reports a chronic cough. I don't think this is our key here. With COPD, they're going to be a touch hypoxic. 91% is okay on room air for them. And they are going to have a chronic cough. That's part of our disease process. Those are expected findings. We can move on. Our next option, option 2, is a client with atrial fibrillation, an elevated heart rate, and reports occasional fluttering feeling in the chest. So with AFib, our heart it's fibbing, it's quivering, right? It's not getting that full pump. So they may feel that flutter. That's normal. An elevated heart rate, we may need to look into. We can't totally rule this one out yet. So let's move on to option 3. With option 3, we have a client with fibromyalgia, fatigue. They're reporting generalized pain rated as a 7 on a scale of 0 to 10. So those are both normal findings with fibromyalgia, and we do want to treat our client's pain, but that's normally not going to be our priority. We want to treat physiological compromising problems first before we address pain. So that's not our key. Let's move on to option 4, which is a client with heart failure, edema of the lower extremities, and reports dyspnea. So with heart failure and the edema and the dyspnea, those are signs that we have fluid where it shouldn't be. Okay, the heart's not keeping up. We're having fluid back up, and eventually that gets into the lungs. We can't breathe. So let's use our ABCs here. Breathing is a big deal. So that's going to be our key. That's the client we need to assess first. The nurse assessing a client who had a coronary artery bypass graft surgery 1 day ago and notes muffled heart sounds on auscultation. So a coronary artery bypass graft surgery, we call it CABG most commonly, and we're doing an assessment. This is a very invasive procedure. It's high risk, it's necessary, but it can cause a lot of problems. So, and we need to know that muffled heart sounds are never normal. We should never see those. Those are usually indicative of cardiac tamponade, and from a procedure like a CABG or an MI, we have a sudden rush of fluid that happens in the pericardial cavity. So we have increased pressure in there, the heart can't work like it's supposed to, our cardiac output goes down, we have muffled heart tones. So we need to know all of that before we move into our options, okay? So in our options, it's which of the following actions should the nurse take? Option 1, administer IV furosemide. I could see how somebody would think this is an option. However, if we're dealing with decreased cardiac output, we don't want to also volume deplete this client. We want to make sure we give them enough volume to work since the cardiac output is so low. So that's not going to be our key. With option 2, notifying the healthcare provider. This is going to be our key. So cardiac tamponade is an emergency. It's not really something that nursing can do a lot of interventions for, but we have to recognize it. We're the ones at the bedside. We have to be the ones to notify the healthcare provider so we can get in and treat this condition. With option 3, placing the client in the semi-Fowler position. It's not going to hurt anything, but it's not going to help. So it's not really our key here. And then on option 4, document the finding in the client's electronic medical record. this is not something we just want to document and move on with. We definitely have to notify the healthcare provider. This patient is going to need a pericardiocentesis to get that fluid out, and that's something we need the doctor for. So it says the nurse is preparing to administer digoxin to a client. Which of the following findings would require follow-up prior to administering the medication? So when we have a question phrased this way, something would require follow-up. We're looking for something that's wrong. It's a contraindication to giving digoxin or dig. So let's think about what we know about dig. We know that it's a positive inotrope. That means that it is going to increase the contraction of the heart. That's going to increase our cardiac output. We also know that dig is a negative chronotrope. That means it's going to slow the heart rate down. So knowing those couple of things about our medication, let's get into our options. Option 1 is a heart rate of 56 beats a minute. That would be a contraindication to administering dig to this client. With dig, we want to make sure our heart rate, we assess it for a full minute, and we want it to be above 60. Since dig does slow the heart rate, we need to make sure we're starting at a high enough level to allow for that beat to slow down. So that is going to be our correct answer here. But let's take a look at our other options. Option 2, a temperature of 99.1 Fahrenheit or 37.3 Celsius. Dig doesn't have any effect on our temperature. As long as we're in a pretty normal range and we don't have anything else going on cardiac-wise, our temperature isn't really going to matter when we give dig. We can go ahead and give that safely at that point. With option 3, a respiratory rate of 22 a minute. Again, not associated with dig. We would maybe want to look at our respiratory rate if we were giving something like an inhaler, but for this medication, it's not necessary. And then option 4, a blood pressure of 90/48. You do want to monitor your blood pressure when you're giving any cardiac medication. Our heart and our blood pressure do work together. A slightly low blood pressure like that of 90/48 isn't a contraindication for dig. And with dig, if we are making the heart, beat stronger, our cardiac output is going to go back up. That's going to help our blood pressure. So that'd be okay there. So just circling back to option 1, our correct answer, we definitely want to hold dig if our heart rate is less than 60. The nurse is reviewing new medication prescriptions for a client who is receiving clopidogrel. The nurse should clarify the prescription for what? So here we are looking for a medication that should not be given with clopidogrel. So clopidogrel inhibits platelet aggregation. We normally give it after an MI, to prevent stroke, those kind of things. So good to kind of keep that in mind as we're going through this. Option 1 is metoprolol. This is not our correct answer here. It is okay to give metoprolol with clopidogrel, and they're often given together, especially after patients have had an MI. They're going to need that beta blocker. Also going to need, to kind of thin out the blood, prevent platelets from forming more clots. So those are often given together, and that's totally safe. Not our correct answer. Option 2 is furosemide. Furosemide is a loop diuretic. It is safe to give with clopidogrel. You'd probably see it given a lot with clopidogrel as well. We're thinking patients have cardiovascular disease. Furosemide's a pretty common medication there. So not our correct answer. Option 3 is omeprazole. Omeprazole is a proton pump inhibitor, and this is going to be our correct answer because it does interact with clopidogrel. So omeprazole will decrease the therapeutic effect of clopidogrel, meaning it's not going to work to inhibit platelet aggregation as well, meaning we might get a clot. That's kind of problematic, right, when we think we're giving something to prevent it. So we want to avoid giving omeprazole to these clients receiving clopidogrel. A good alternative would be like an H2 blocker like famotidine. Something like that would work really well for these clients instead. And then option 4 is levothyroxine. This is artificial thyroid hormone. We give it to our clients with hypothyroidism, and it is safe to give with clopidogrel. We do want to avoid it for clients receiving warfarin. We don't want to give them levothyroxine in that case because it can actually increase the therapeutic effect of warfarin and then put us at risk for bleeds. So hopefully that helps. The nurse is teaching a client who has a new mechanical heart valve and is taking warfarin. Which of the following information should the nurse include? Select all that apply. So we are going to have more than one correct answer here. So let's look at our options. And option 1 says to request prophylactic antibiotics before any invasive dental procedure. So clients with mechanical heart valves are at risk for infective endocarditis, which is where bacteria can enter, and in this case, through the gums and whatnot when we're doing a dental procedure. You know, the mouth is gross. There's a lot of bacteria in there. So when we're in there poking around, bacteria can get into the bloodstream and land right on our fresh new mechanical heart valve, which would be so terrible. So we want to give antibiotics just to prevent that bacteria from getting and developing and spreading and all that where it shouldn't be. And we'll talk a little bit more about that with option 2. And so option 2 says to notify your healthcare provider if you develop flu-like symptoms. So these are going to be symptoms of infective endocarditis. Okay, bacteria where it shouldn't be, it's going to cause symptoms like fever, fatigue, chills. Another big thing with infective endocarditis are splinter hemorrhages, like in your nails. So you'll see those like red streaks. That's kind of a big red flag. We definitely want them to call the healthcare provider if they experience any of those symptoms. So that is going to be a correct option. Option 3 says to take naproxen to relieve minor aches and pains. We do not want to tell our clients to do this. Clients with mechanical heart valves are going to be, on warfarin, have that anticoagulation, and naproxen is going to increase the risk of bleeding there. So we don't want to do that with warfarin. We're already at really high risk for bleeding. So we want to minimize that. They could take like Tylenol or something like that instead. And then option 4 says to schedule routine monitoring of your INR. This is something we want to do on warfarin. We want to make sure we're at a therapeutic level. Blood isn't too thick, blood isn't too thin, kind of just right, so we don't develop any clots on that mechanical heart valve. Anytime we have something like mechanical in the heart like that, we're at increased risk for clots. The body just doesn't like it. It wants to go clot it off and stop it. So we need to tell the blood to calm itself down. Give it a little warfarin, make sure it's therapeutic and it'll be good to go. And then option 5 says to avoid using an electric razor to shave. We don't want to tell them to do this because we want them to use the electric razor. The electric razors are much safer than like a traditional blade razor where they could cut themselves. And again, our risk for bleeding is high with the warfarin, so we want to avoid that. But hopefully that helps. The nurse is caring for a client with newly diagnosed atrial fibrillation or AFib. Which of the following actions should the nurse take? So option 1 says prepare the client for immediate cardiac defibrillation. This is an incorrect option. Please do not do this for your clients with AFib. It won't go well for either one of you. So we use defibrillation for VFib, ventricular fibrillation, or pulseless VTAC. When we're delivering that electricity to the heart, trying to like restart the SA node, get it to like do its job again, kind of wake back up. We don't use that for AFib. That's not the problem in AFib. It's not going to fix our problems in AFib. So not our correct answer here. Option 2 says to instruct the client to bear down using the abdominal muscles. This is known as the Valsalva maneuver. It helps induce like vagal pressure. We don't want to do this for clients with AFib. It's just not going to help. We do this for clients with SVT where they have that really elevated heart rate and we need to kind of slow things down. But it's not going to work for AFib, so it's not necessary. And then option 3 says to teach the client about the need for long-term anticoagulation therapy. This is going to be our correct answer. With AFib, our atria are just kind of like quivering. They're not getting a good effective pump to move blood forward. So blood is going to stay in our atrium. And when that happens, it's going to develop a clot. Like anything that sits for a long time gets kind of gunky and gooped up. So we're going to start forming clots, which then can move through the rest of the heart and then give us things like a stroke. So we definitely want to anticoagulate, prevent those clots from forming and prevent, negative outcomes like that stroke. Okay, and option 4 says to monitor the client's laboratory test results for an increased serum TSH level. An increased serum TSH level is associated with hypothyroidism, but hyperthyroidism would be associated with AFib and can be a common cause of AFib. So that's not going to be our correct answer here. So option 3 is where the money is today. The nurse is assessing a 54-year-old client during a routine physical examination. Which of the following findings would indicate that the client is at increased risk for developing hypertension? Select all that apply. So we are going to have more than one correct option here. So option 1, having a first-degree relative with hypertension. This is going to be a risk factor. So one of our correct answers here, this is a non-modifiable risk factor, right? We can't change our family, unfortunately, sometimes. But that definitely is going to contribute to development of hypertension. We don't know exactly why some of those genetic risk factors occur, but nonetheless, here we are. Option 2, smoking 1 pack of cigarettes per day. This is going to be another correct answer. Any sort of tobacco use is going to increase our risk for hypertension. This is something that we can change. It's a modifiable risk factor. So if we cut back on our tobacco use, we're going to lower our risk for hypertension, among other things. Option 3, having a history of obstructive sleep apnea. This is also a correct answer. It's going to increase our risk for hypertension. If our obstructive sleep apnea is treated properly, that's definitely going to help. So using things like a CPAP at night and whatnot, that'll definitely help us out, but it is still a risk factor. Option 4, a history of melanoma. This is not a risk factor for hypertension, and actually it kind of works the other way. Hypertension is a risk factor for certain cancers, renal cancers and things like that, but melanoma itself is not a risk factor for developing hypertension, so not a correct answer. And then option 5 is a BMI of 30. That is going to be a risk factor for hypertension. A BMI of 30 is considered obese, so definitely increases our risk there. Another thing that kind of contributes there can be physical inactivity, which will also increase our risk for hypertension. This, again, is a modifiable risk factor, so if we can drop some weight, exercise more, we may be able to lower that risk for developing hypertension. Our question says, the nurse in the emergency department is caring for assigned clients. Which of the following clients should the nurse assess first? So when we have the word first here, we are looking for the client that has the most severe disease process happening, the one that's going to be the most urgent, require the most intervention. So option 1 says a 32-year-old client who has right lower quadrant abdominal pain and rebound tenderness. This is an incorrect option. Those are signs of appendicitis, which we do want to treat, but not in comparison to what's coming next. Option 2 is a 54-year-old client who has severe back pain and a pulsatile mass in the periumbilical area. So that pulsatile mass is indicative of an abdominal aortic aneurysm, or a AAA. And then the severe back pain, that's a big clue that something has ruptured. So that aneurysm, if we have like our artery walls, the aneurysm is a weakening in the wall. It'll form an outpouching, and as pressure builds there, eventually that'll rupture. The aorta is huge, so we're going to bleed very quickly. We're going to have massive hemorrhaging if this happens, hypovolemic shock, the whole thing. Mortality rate is really high here. We need emergency surgery. This client is 100% going to be our priority in this case. But let's look at option 3 and 4 too. So option 3 is the 74-year-old client who has fever, nausea, and left lower quadrant abdominal pain. This is going to be associated usually with diverticulitis. Definitely you're going to need some care, some antibiotics, some fluids, but not a not as high of a priority. And then option 4 is our 87-year-old client who has confusion, suprapubic pain, and dysuria. These are indicative of UTI. UTIs in an 87-year-old client will cause confusion. So if we ever see, an older adult client that's confused, we definitely want to check their urine first to see if we can kind of rule out some other things. But again, going to need antibiotics, but not as high of a priority as somebody that's at risk for, that life-threatening hemorrhage. The nurse is assessing a client who had coronary artery bypass graft surgery 1 day ago and notes muffled heart sounds on auscultation. Which of the following actions should the nurse take? So we know that muffled heart sounds are never normal. So after a CABG, we can have a sudden rush of fluid into the pericardial cavity that increases the pressure within the pericardial cavity, decreases our cardiac output, and we're going to hear muffled heart sounds. So with that in mind, let's look at our options. Option 1 says to administer IV furosemide. This is going to be an incorrect option. We already have decreased cardiac output. We don't want to volume deplete this client. We want to make sure they have enough volume to maintain a good cardiac output. Option 2, it says to notify the healthcare provider. This is going to be our correct option. This client is going to need a pericardiocentesis. There's not a ton of nursing intervention we can do here. We definitely just want to make sure we get the healthcare provider notified immediately. Option 3 says to place the client in the semi-Fowler position. This is an incorrect option. It's not going to hurt this client, but it's not really going to help. Maybe if they're having an increased work of breathing, we could sit them up. That may be helpful, but not the right option. And then option 4 says to document the finding in the client's electronic medical record. We definitely want to document, but that isn't the only thing we want to do. We definitely want to get intervention for this client. The nurse is caring for assigned clients. The nurse should first assess the client who has what? So notice that word first is in bold. We are looking for the client who is the most sick, the most at risk, something like that. So option 1 is the client with chronic obstructive pulmonary disease or COPD, a pulse oximetry reading of 91% on room air, and reports a chronic cough. This is an incorrect option here. With COPD, we can expect our clients to be a little hypoxic. 91 is just fine. A chronic cough is characteristic of the disease. Option 2 is the client with AFib, an elevated heart rate, and reports an occasional fluttering feeling in the chest. That fluttering feeling may be normal with AFib. We definitely want to look into that heart rate, but not first in light of our next client. Option 3 is the client with fibromyalgia, fatigue, who reports generalized pain rated as 7 on a scale of 0 to 10. This is going to be an incorrect option. That pain is expected with fibromyalgia, so we definitely want to treat their pain, but not first. And then option 4 is our client with heart failure, edema of the lower extremities, and dyspnea. This is going to be our correct option. When we have heart failure, that fluid is going to back up into the lungs in places it shouldn't go. That's going to make it very difficult to breathe. So using our ABCs, we know that dyspnea is under breathing for B, so that's going to be our correct option. The nurse is preparing to administer digoxin to a client. Which of the following findings would require follow-up prior to administering the medication? So let's think about what we know about DIG. DIG is a positive inotrope, so it's going to increase contraction, it's going to increase our cardiac output, okay? And it's also a negative chronotrope, meaning it's going to slow our heart rate. So let's look at our options. Option 1 says a heart rate of 56 beats per minute. This is going to be our correct option here. We would want to follow up. We want to make sure we're assessing that heart rate for a full minute before administering DIG. Anything usually under 60, we definitely want to consider notifying the healthcare provider or clarifying before we administer. We want to make sure that since DIG is going to lower that heart rate, we start with kind of a good baseline. We don't lower it too much. Option 2 says a temperature of 99.1 degrees Fahrenheit. This is going to be an incorrect option. DIG doesn't really have any correlation with our temperature. Option 3 says a respiratory rate of 22 per minute. Again, an incorrect option. We don't really have a correlation much with DIG and a respiratory rate. Definitely wouldn't be a reason to avoid it. And then option 4 is a blood pressure of 90/48. This is an incorrect option as well. While we do want to monitor a blood pressure for anybody receiving cardiac medications, it isn't the priority when we are giving DIG. We definitely want to look at that heart rate first. The nurse is teaching a client with newly diagnosed hypertension. Which of the following information should the nurse include? Select all that apply. So we are going to have multiple correct options here. Option 1 says consider participating in a smoking cessation program. This is going to be a correct option. We know that smoking increases the risk for hypertension and makes existing hypertension worse, so we definitely want our clients to stop smoking. Option 2 says to practice stress management techniques. This, again, a correct option. We know that stress contributes to high blood pressure, so we want to do anything we can to reduce that. Option 3 says to engage in moderate exercise every day. Again, a correct option. We know that good regular exercise definitely lowers our blood pressure and our risk for worsening hypertension. Option 4 says to consume a low fiber diet. This is going to be an incorrect option. For a client with hypertension, we'd likely want them on a heart healthy diet. So something with like lean meat, avoiding red meats, maybe a sodium restriction or something like that. Option 5 says to check your blood pressure before taking metoprolol. And this is going to be another correct option, especially when we have someone with newly diagnosed hypertension. They likely have a new prescription for metoprolol. We want to make sure we're checking our blood pressures to make sure we're not over or under medicating this client. Nurse has taught a client about the prevention of deep venous thrombosis, or DVT. Which of the following statements by the client would require follow-up? So we are looking for an incorrect statement to be our correct option here. Option 1 says, I am not at risk for developing a new DVT because I have had a DVT in the past. And this is going to be our correct option because it's an incorrect statement. So a history of DVT does increase the risk for future DVTs. Option 2 says, I will plan rest stops during long car rides to get out of the car and walk around. That is an incorrect option, and we'll talk about it with option 3, which says I should wear compression stockings on days when I am working long hours. Again, 3 is an incorrect option. While both 2 and 3 are correct statements, we want to make sure that we are promoting venous return, so making sure that we're taking breaks frequently when we are plane or car traveling, if we can, stand up and walk around, and wear compression stockings just to help kind of circulate that venous blood. And then option 4 says, I will notify my healthcare provider if one of my legs looks larger than the other. It's an incorrect option, but a correct statement. So signs of DVT are things like unilateral, edema, redness, warmth, tenderness, like those kind of things to, just to one leg. So 4 is an incorrect option.
The nurse is reviewing new medication prescriptions for a client who's receiving clopidogrel. The nurse should clarify the prescription for what? In this case, we need to know what should not be given with clopidogrel. What would be a contraindication? So we need to know that clopidogrel is an antiplatelet medication. It prevents clot formation. It reduces platelet aggregation. So we can get into option 1, metoprolol. This is a beta blocker, often used with clients with a faster heart rate for rate control, also used for blood pressure management. It does not affect clopidogrel, so it is okay to use, so this would be an incorrect answer. Furosemide, option 2, this is a loop diuretic, also given with cardiac clients with fluid overload. Again, it does not have an effect on clopidogrel, so it is okay to use and an incorrect option. Option 3, omeprazole. Omeprazole is a proton pump inhibitor. It actually decreases the effectiveness of clopidogrel, so this would be our correct answer. If omeprazole is affecting clopidogrel, it's going to cause clopidogrel to not work the right way, and it will cause clots to be formed. So this would be our correct answer. Instead, we will want to give something like an H2 blocker. This is like famotidine. That would be a better option to use with clopidogrel. But then option 4, levothyroxine. This is an artificial thyroid hormone given to clients with hypothyroidism, but it does not have an effect on clopidogrel, so it is okay to give. So our correct answer for today is option 3, omeprazole. The nurse is teaching a client who has a new mechanical heart valve and is taking warfarin. Which of the following information should the nurse include? Select all to apply. So there's going to be more than one right answer with the select all to apply. Option 1, request prophylactic antibiotics before any invasive dental procedure. This is going to be a correct answer. We want the patient to prophylactically be on antibiotics because any little bacteria can get into their bloodstream and travel down and infect their new heart, and that can lead to endocarditis, which is not something we want. So that is a correct option. Option 2, notify your healthcare provider if you develop flu-like symptoms. So again, like option number 1, Fever, fatigue, chills, those are all things that the client should be aware of and report to their healthcare provider. These are flu-like symptoms, which are also symptoms of endocarditis, so we want to treat those quickly. So correct option. Option 3, take naproxen to relieve minor aches and pains. Naproxen is an NSAID, and it can actually increase your risk of bleeding, which is, they're already taking warfarin, so we don't need to further increase the risk of bleeding. So this would be an incorrect option. If they're having minor aches and pains, we would want to give them Tylenol instead. Option 4, schedule routine monitoring of your INR. This is a correct answer. We definitely want to continue monitoring their INR. We don't want their blood to be too thin or too thick and create blood clots, so we want to keep it in a therapeutic range, so this is a correct option. And option 5, avoid using an electric razor to shave. We actually want our clients to use an electrical razor. It's much safer, it reduces the risk of them cutting themselves, so we want them to use an electrical razor. So this would be an incorrect option. So our correct answers for today are 1, 2, and 4. Thanks.
The nurse is caring for a client who is receiving IV vancomycin through a peripheral venous access device, or VAD, V-A-D. Which of the following actions should the nurse take? Select all that apply. So we're going to have multiple correct options here. Let's look at them. Option 1 says instruct the client to report any hearing changes. This is going to be a correct option. So vancomycin or vanc can be ototoxic and cause damage to the ears. We definitely want to note those changes in hearings. We may need to reduce the dose or discontinue it altogether. Option 2 says to monitor the VAD insertion site frequently for erythema and swelling. This is going to be another correct option. Vanc can cause phlebitis, can cause tissue necrosis. We want to monitor for any abnormal findings at our AV sites. Option 3 says to use an infusion pump to administer the medication over 20 minutes. This is going to be an incorrect option. Vanc can cause tachycardia, hypotension, a rash. We definitely want to infuse it usually over greater than an hour. Option 4 says check the client's serum creatinine level prior to administering the medication. This is going to be a correct option. Vanc is nephrotoxic, so if we have renal impairment or an elevated creatinine, we will need a renal adjusted dose or potentially a different antibiotic altogether. And then option 5 says to obtain a serum trough level after administering a scheduled dose of the medication. This is going to be an incorrect option. So because vanc is nephrotoxic, ototoxic, those kind of things, we want to make sure our clients aren't getting too much. We want to draw a trough once they're on vanc therapy, usually before the third dose. This is going to tell us how much medication is in their system and if we need more or less for our future dose. So our correct options today are 1, 2, and 4. The nurse has taught the spouse of a client with hepatic encephalopathy who is receiving lactulose. Which of the following statements by the client's spouse would indicate a correct understanding of the teaching? So first, we need to talk about hepatic encephalopathy a little bit. It results from liver disease or cirrhosis where the liver can't filter out toxins. So we get a buildup of ammonia in our system. It causes acute mental status changes, confusion, agitation, asteriscus, those kind of things. So let's look at our options. Option 1 says the medication may cause constipation. This is going to be an incorrect option. Lactulose is a laxative. It's going to cause diarrhea in these clients. Option 2 says the medication is administered as an injection. This is going to be an incorrect option as well. Lactulose works directly in the colon to excrete ammonia, so it's usually given orally or rectally, but never intravenously. Option 3 says the medication will improve my spouse's confusion. This is going to be our correct option. So because lactulose helps excrete ammonia, that's going to improve our confusion. We're going to have more clear thinking, those kind of things. And we often want to adjust the dose based on our client's mental status. And then option 4 says the medication will decrease my spouse's liver enzyme levels. This is an incorrect option. It's not going to touch the liver enzyme levels. We really give it for the complication of the liver condition. It doesn't actually treat the liver condition itself. So our correct option for today is option 3. The nurse is caring for a client with a new mechanical heart valve. The nurse should expect that the client would be prescribed what? So let's look at our options. Option 1 is warfarin, and this is going to be our correct option. So we know warfarin is a vitamin K antagonist. It's going to reduce the risk of clot formation on that mechanical heart valve. We definitely want to teach those clients to get frequent lab checks, to monitor their INR, and we definitely want to keep it in that therapeutic range. Option 2 is Digoxin. This is a thrombin inhibitor. It's an incorrect option. It's actually contraindicated for clients with mechanical heart valves. Usually we give it for a DVT, a pulmonary embolism, or stroke for clients that have atrial fibrillation. Option 3 is tacrolimus. This is an immunosuppressant or anti-rejection medication given for clients with a transplanted organ, not needed for a mechanical heart valve. And then option 4 is apixaban. This is a factor 10A inhibitor, similar to dabigatran in that it is not indicated for mechanical heart valve. It's just not the best choice for these clients. We want to get these clients on warfarin. Option 1. The nurse is caring for a client who is receiving sertraline. It would require follow-up if the client reports what? So here we're looking for a problematic finding, okay? Option 1 says drowsiness and fatigue. This is going to be an incorrect option. It can happen when we start an SSRI like sertraline, but that'll improve the longer we take the medication. At first, though, we do want to avoid driving, maybe other CNS depressants like alcohol, those kind of things that can worsen that drowsiness. Option 2 says diaphoresis and fever. This is going to be our correct option. It requires follow-up because these are findings of serotonin syndrome. Basically what happens is we have excess serotonin floating around in the brain when we're taking sertraline. That helps increase our mood, but it increases that circulating serotonin and increases those symptoms like diaphoresis, fever, agitation, tachycardia. We want to discontinue that medication, give supportive care. This is an emergency for that client. Option 3 is a decreased libido. This is going to be an incorrect option. It is a known expected kind of side effect, but it does really increase the risk for noncompliance. So we definitely want to open that discussion, but it doesn't necessarily require follow-up. And then option 4 is weight gain. This is going to be an incorrect option as well. Clients can experience weight gain or weight loss with SSRIs, another big reason for noncompliance, but it's not life-threatening. So our correct option for today is option 2. The nurse has had a client with hypertension who has a new prescription for Ramipril. Which of the following statements by the client would require follow-up? So let's look at our options here. Option 1 says I should discontinue the medication if I develop swelling of my lips or eyes. This is going to be an incorrect option because it doesn't require follow-up. This is true. We want them to discontinue this medication if they develop that swelling. That's angioedema. It can compromise the airway. We definitely want to stop the medication and notify the healthcare provider. Option 2 says, I will avoid taking a potassium supplement with the medication. This is going to be an incorrect option as well because it is a true statement. It doesn't require follow-up. We want to avoid potassium supplements or potassium-sparing diuretics. It increases the risk for hyperkalemia and cardiac dysrhythmias with ACE inhibitors. Option 3 says I can continue taking the medication if I become pregnant. This is going to be our correct option because it requires follow-up, okay? So Ramipril ACE inhibitors can cause renal dysfunction to the fetus in utero. It can pass through breast milk as well. So we will need some other medication to control our hypertension if we become pregnant. And then option 4 says I may develop a dry cough while taking the medication. This doesn't require follow-up. It is a true statement. It's kind of annoying for these clients, but it's not harmful. Sometimes we can switch to like a beta blocker or something else if it becomes a problem, but it doesn't really require follow-up. So our correct option for today is option 3.
The nurse is caring for a client who is receiving a transfusion of packed red blood cells. The nurse notes the client becomes hypotensive, tachycardic, febrile, and short of breath. Which of the following actions should the nurse take first? Be sure and drop your answer in the comments. Option 1, document the client findings. Option 2, notify the healthcare provider. Option 3, stop the transfusion of packed red blood cells. Option 4, continue to monitor the client's vital signs. Let's start with this question. We see the word take first in there. We're looking for our priority intervention. When we're talking about this question and the signs and symptoms we're seeing, it looks like this client's having a transfusion reaction. So we know our priority intervention is to stop that transfusion. We don't want any more blood going to that client. So our correct answer on this one is going to be option 3, stop the transfusion of packed red blood cells. The nurse is observing a staff member care for a client experiencing hypovolemic shock from a severe gastrointestinal bleed. The nurse should intervene if a staff member is observed. Go ahead and drop your answer in the comments. Option 1, establishing a second IV access with a 16-gauge catheter. For this question, it says intervene, so we're looking for the incorrect action. This is a correct action. When we have hypovolemic shock, we need to have multiple IV access so we can replenish fluid volume. Option 2, connecting the client to continuous cardiac monitoring. Again, this is a correct action. We need to monitor our heart for any dysrhythmias. Option 3, positioning the client in the high Fowler position. This is our correct answer because this is an incorrect action. When we have hypovolemic shock, we want our heart to be perfusing our vital organs. We don't want it to fight against gravity if our client's in the high Fowler position, so we want them reclined in a flat position. Option 4, initiating rapid transfusion of 0.9% sodium chloride. Again, this is a correct action, so an incorrect option. We want to give IV fluids, blood, anything like that to replenish our circulating fluid volume when we have hypovolemic shock. So our correct answer is option 3. The nurse has taught a client with iron deficiency anemia. Which of the following menu selections by the client would indicate a correct understanding of the teaching? Be sure and drop your correct answer in the comments. Option 1, scrambled eggs with orange slices. Option 2, lentil and black bean stew. Option 3, tomato soup with grilled cheese toast. Option 4, peanut butter and banana sandwich. All right, let's look at this question. So the question says correct understanding. So we are looking for the true statement, the true option here. When we're talking about iron deficiency anemia, we're looking for foods that are going to be high in heme iron. So our correct answer on this one is going to be option 1, scrambled eggs with orange slices. That's going to be our combination of foods with high heme iron, which is our eggs, and orange slices, which helps to absorb that iron better. The nurse is assessing a client with suspected aplastic anemia. Which of the following findings would support a diagnosis of aplastic anemia? Select all that apply. Be sure and drop those answers in the comments. Option 1, thrombocytopenia. Option 2, hypoglycemia. Option 3, neutropenia. Option 4, polycythemia. Option 5, hyperlipidemia. All right, so let's talk about this question. First, we see select all that apply. That means that we're going to have more than one right answer. Now let's talk about aplastic anemia. Aplastic anemia is a condition that causes myelosuppression or pancytopenia. That means suppressed elements of our bone marrow. So what we're going to see is decreased red blood cells, which is the anemia part, decreased white blood cells, which is the neutropenia part, and decreased platelets, which is thrombocytopenia. So our correct answers on this one are going to be options 1, thrombocytopenia, and option 3, neutropenia. The nurse is teaching a client with sickle cell disease about lifestyle modifications to prevent episodes of acute pain. Which of the following statements by the client would indicate a correct understanding of the teaching? Select all that apply. Remember, select all that apply means you're going to have more than one right answer. Be sure and drop those answers in the comments. Let's walk through this. Option 1, I should avoid exposure to large crowds. Again, we're looking for correct understanding, so we're looking for true statements. This is a true statement when we're talking about sickle cell. Sickle cell, especially episodes of acute pain, happens when those sickled red blood cells that we get with sickle cell clump together and cause ischemic pain. So things that can trigger those episodes can be infection, so that's why we want to avoid exposure to large crowds. Option 2, I should continue walking and practicing yoga daily. This is a true statement, so a correct answer. We want to continue moving to promote circulation. Option 3, I will increase my fluid intake in warm temperatures. Dehydration is another trigger for sickle cell, so this is a true statement and a correct answer. Option 4, I may require hospitalization if I develop an infection. Again, going back to those triggers for those acute episodes, infection is one that can cause those acute episodes of pain. So we may require hospitalization for medication to help with infection, but also to manage that pain. Option 5, I will experience more mild symptoms in high altitude locations. This is an incorrect statement, so a wrong answer. High altitude can trigger episodes of acute pain. So our correct answers on this one are options 1, 2, 3, and 4. Thanks for stopping by. Be sure and check out the link in our bio for more information.